Well, the coronavirus lockdown has been especially tough for people dealing with addiction. Their support meetings have been canceled. Joining us now to discuss this struggle are TV psychotherapist Dr. Robi Ludwig and Dr. David Tooze, a Banyan Chicago executive director. Dr. Robi, as we like to call you, give us an update. This must be a very difficult time for people with addictions.
It is. We know that people who suffer from addictions, and we're talking about 20 million people here in this country, are especially vulnerable to relapsing whenever there's a national crisis. So here we have a pandemic that's really forced a vulnerable population already to self-isolate. So they're vulnerable in a couple of ways. One, to relapsing, and two, very often they have a lot of physical ailments that make them more vulnerable to coronavirus already. So they're vulnerable in multiple ways.
Dr. Tooze, share with us your experience. What are some of the challenges you're facing in helping your patients right now?
Well, I think we're addressing some fear about people wanting to come into treatment initially. And they need to know that we're doing everything that we can to make sure that the facility is safe, that our staff are safe. We're following CDC guidelines. The issue is that with the anxiety, stress, isolation that person is feeling sitting at home with their stockpile of alcohol and prescription medication, it's best that they get into treatment and get help with those situations. I want to make sure I emphasize that the emergency rooms do not need to be overwhelmed right now. And so it's best to call a detox and get into a detox. And then you'll go through days, weeks, maybe 30 days in treatment, which is much better than sitting in your living room.
Dr. Tooze, when somebody has an addiction and they go in with COVID-19 to an emergency room, are they treated differently? Are there treatments that work differently because they have various addictions?
So my understanding is that the COVID is going to be the primary concern if a person shows up at an emergency room with an addiction. As far as the medications and things used to treat, that's out of my realm of expertise at this. Yeah.
Dr. Robi Ludwig, just, looking ahead, for any of us dealing with isolation and being at home, it can be challenging for us from a mental health standpoint. What is your advice to folks at home, whether they're battling with addiction or just having a really hard time in this current situation? What are your biggest concerns and your advice for folks?
I think what's most important is connecting. And even though we may not be able to connect face-to-face right now, there are virtual ways to connect. So 12-step programs now are having Zoom meetings. It might not be as ideal as face-to-face, but at least it's something. If somebody is in addiction treatment already, they probably have a sponsor. If they're part of an AA or NA program, reach out to a sponsor. And right now, most doctors and therapists are engaging in telehealth. So you can get that virtually as well. So in some ways, it's a positive time to reach out and connect on multiple levels, not only with family, but with physicians as well.
Dr. Tooze, final thoughts?
Reach out for help. If you're sitting at home watching a lot of endless coverage about this pandemic and turning to substances for stress relief, stop. Reach out for help, and help is there for you.
Sound advice. Dr. Ludwig and Dr. Tooze, thank you so much for joining us today. We appreciate your insight and advice.